All right. Well, good morning, everyone, and welcome to the 2024 Infection Prevention Boot Camp. I'm Dr. Julia Frith, your host for today's virtual event, and I am thrilled to see so many of you joining us from different corners of Kentucky and clearly beyond to strengthen our defenses against infectious diseases. So before we jump into the exciting content that we have planned for today, let's take a moment to understand what this boot camp is all about. So our infection prevention boot camp is designed to equip you with the knowledge, skills, and resources necessary to prevent the spread of infections in your workplace and community. Whether you're a healthcare professional, an educator, or a caregiver, this boot camp has something valuable for everyone. We welcome esteemed members of the CDC, the Kentucky Department for Public Health, IPNC Consulting, and the Kentucky Infection Prevention Training Center. Now, for some housekeeping items, as this is a virtual event, we want to acknowledge that technical issues may arise. And so if you encounter any difficulties during the boot camp, please do not hesitate to use the Q&A feature on the bottom of your screen. Chelsea Song's email has been sent out in the chat, and one of the members of our team will work with you either via email or the Q&A feature to mitigate those issues. Additionally, the chat function has been disabled during presentations in general. You will be notified when the chat has been opened, and we encourage you to interact with the presenter during the question and answer portion of their presentations. Some of the presentations will have audience participation and interaction, and during those moments, chat will be open. So we will open chat during presentations as applicable, and for sure during questions and answers at the end. So just as you all may experience technical difficulties, we may also experience some on our end. And so we just ask that you remain patient if these moments arise, and while our technical team works to get us back on track. If we lose connection during the event, you may log in the same link that you used to log in this morning. So if you get disconnected or if the whole thing gets shut down, just sign back into that link and we'll all be in the same spot again. I do want to point out that there are timers that can be located in the bottom of your of each introduction. This is allow me to introduce our speakers, allow the speakers time to share their screen. And there are several breaks we have added to the agenda, but this time will also allow the next presentation to start. And so you'll know when it's going to start. So if you need to step away, you need to answer a call, do whatever, you know that you've got a bit of time between each of those presentations while we transition to the next individual. You kind of know where we are in that agenda. This presentation is being recorded and will be placed on the Kentucky Infection Prevention website. We have worked hard to create a presentation that will adhere to a schedule, but because our presenters are so passionate, there may not always be time for a question and answer portion. If that occurs and you have questions, please do not hesitate to use the Q&A feature, and we will ensure that all questions get answered. So obviously we'll open it up for questions and answers, but if we don't get to them all, your questions will be answered, and we will put those with the recording and the ebook on our website. Finally, I'd like to point out that the Kentucky Infection Prevention Training Center is continuously developing and providing new content. We have a series of engaging sessions and workshops lined up in the future to further enhance your understanding of infection prevention. You can find information about these upcoming events and how to register in the chat window. We'll also have QR codes throughout the presentation that you'll be able to utilize as well. Please be sure to visit the Kentucky Infection Prevention website and engage with us beyond the boot camp. And if you are enjoying the boot camp today, don't hesitate to post about it on social media and tag the Kentucky Infection Prevention Training Center. And so we have a very action-packed agenda ahead of us today. We will work very diligently to answer all of those questions should something come up in your presentation. So please be patient and we will answer raised hands and the like. So we will go ahead and get started. So without further ado, let's dive right in. So, ladies and gentlemen, so it is my pleasure to welcome Dr. Janet Glowicz to our Infection Prevention Boot Camp today. Dr. Glowicz brings a wealth of experience and expertise to our virtual stage as a nurse infection preventionist with Project First Line at the CDC Division of Healthcare Quality Promotion. With a background in practicing infection prevention in both outpatient and acute care settings, Dr. Glowicz has honed her skills and knowledge in the field. At the CDC, she serves as a subject matter expert for hand hygiene, playing a crucial role in guiding best practice and strategies to combat infectious diseases. Dr. Glowitz's passion for infection prevention extends beyond her desk as she enjoys being on site at healthcare facilities, engaging with frontline personnel, and witnessing firsthand the implementation of infection control actions. At this time, I will stop sharing my screen and welcome to Dr. Glowicz as we embark on this journey to strengthen our defense against infections. Dr. Glowicz, you are up.
Good morning. Thank you very much. Happy May Day, everyone.
Yes.
I'm just going to get a couple things settled on my computer. Can you see my screen okay?
We are not seeing your screen
yet. I guess I have to click the share button there.
Perfect. We see you now.
All righty.
Thank you.
You are welcome. Well, thank you very much for being here this morning. I'm excited to be here. I am going to go off screen in just a second so that you can focus on the presentation. And I will invite you to enter comments in the chat and questions in the Q&A. But really what I want to do is just kind of talk you through these slides. So before we get started, I want to just say that these slides were developed for Project First Line with the intent for individuals to use them to train others in hand hygiene. So as I go through the slides, you will have this presentation available to you through the boot camp and through your state health department or your Kentucky HAI group. We can also provide the slides for you to use with a facilitator guide and a script. So I'm not going to focus totally on the content of the slides, but I am going to kind of walk you through the why behind the slides. And feel free to enter comments in the chat, questions in the Q&A box, and I would ask Kelsey and Dr. Frith, please, to kind of help me monitor the chat because I won't see comments come up, but I'm happy to stop and address them during the presentation.
Yes, absolutely.
Thank you. So first of all, I just want to say I have nothing to disclose. And then there are three objectives. One, to talk about healthy hands, skin, and nails, to identify the indications for cleaning hands, and to demonstrate messaging that encourages team building for adherence to hand hygiene. So first of all, I prefer what we see a lot in our products that we see from states around the nation and territories in the United States. So we always want to dive right into when you should clean your hands and how you should do that. And we don't talk a lot about how important a healthcare worker's hands are to healthcare. So, you know, in our CDC guidelines, it does say that hand hygiene is keeping your hands clean. But I like to think about that concept more broadly. So hygiene really is just any activity that is preventive. And when it comes to hand hygiene, having healthy hands, skin, and nails keeps your hands, keeps a healthcare worker's hands from developing colonization with transient bacteria and can reduce the numbers of resident bacteria. So those bacteria that live on your hands all the time that kind of protect your skin, as well as those transient bacteria that a healthcare worker picks up when they're providing care. And we know that hand hygiene is the foundation of infection prevention. I'm so happy to be here, your first speaker during this boot camp, because this is really the basis of all the other infection prevention actions that you will hear about, probably with the exception of its companion, which is keeping surfaces clean. And you will have a talk on that in a little bit. But this is intended to remove and kill germs and prevent the spread of germs. And I like to think of hand hygiene as the kill step. So when you're cooking food in a kitchen or in a nutrition area, the kill step is heating the food up, kills all the germs in the food. And that's, or pasteurization kills the germs. That's how we prevent germs from spreading through food. When you put alcohol-based hand sanitizer on your hands, you are killing the germs. It is your kill step before you touch a patient or a resident of long-term care. But it begins with healthy hands, skin, and nails. And so we just have a graphic here of what healthy hand skin looks like. And you can see it's free from a rash, free from hangnails, short, natural nails that don't extend beyond the fingertip. This person has no fingernail polish. We'll talk about fingernail polish in a minute. Not as big a problem as you would think, but we want hand skin to be free from rashes. And we also want to acknowledge all of the things that can damage the hands of healthcare workers. So, reminding healthcare workers that hand washing itself, water, and brief exposures to water are very irritating to the hands. It causes the hand skin to swell, and then as it dries out, it just damages the outer layer of the skin. Usually people notice it on the backs of their hands first because the layer of skin is very thin on the back of one's hand. So one thing that you can tell healthcare workers is that if they make a fist and their hands feel tight, that really is the beginning of dermatitis. So feeling tight skin on the back of your hands is an indication that you should use hand lotion. Friction, when you think about what happens to your nose when you use a tissue and you have a cold and you're rubbing your nose with a Kleenex, your nose becomes very irritated. Hands that are washed up to 20 times a day can become very irritated by paper towels used to dry them. And then gloves themselves, we often don't think about gloves as being an irritant, but gloves really change the way that the hands manage their water. So it can cause maceration of the hands. So that's when the skin just becomes overly moist and irritated. And it just really changes transepidermal water loss from the hands. Disinfectants are irritating. Chlorhexidine gluconate can cause sensitization. There were studies out of Great Britain that showed that nurses had exposure with chlorhexidine gluconate up to 20 times during a shift. So we use it in bathing. We use it to clean the hubs on IV lines. And it is also in some of the surgical hand preparation and some of the alcohol-based hand sanitizers that are long acting can become an allergen. And rubber accelerators are used in the manufacture of nitrile gloves. They can also be allergens. It has been said that if people have a rash on the palms of their hands that's related to hand hygiene, that is a sign of an allergy, but that is not a good way to diagnose an allergy. If you have an employee that has a rash on their hands, back or front, and it is related to hand hygiene at work, then they need to be seen by occupational health, and their skin needs to be evaluated. Again, irritated skin can carry increased levels of bacteria and can make those bacteria harder to remove. So what do healthy hands look like? And how do we keep them healthy? We use alcohol-based hand sanitizer, and we use it because it avoids that contact with water. If someone is telling you that alcohol-based hand sanitizer stings their hands, it is probably because they have washed their hands too much and they have removed the lipids from their skin. So the cells on the hand skin are like little bricks, and the lipids are the mortar that holds them together. So when you use soap, the purpose of a detergent is to break down fats, and it will break down the lipids in the hand skin, and then the water will wash them away. When that happens, the alcohol-based hand sanitizer has a direct route to those nerve endings that are in the upper layer of the skin, and they will feel the alcohol-based hand sanitizer sting. It is not necessarily the alcohol-based hand sanitizer that is stinging or that causing the stinging as much as it is they need to use facility-approved moisturizers, and they need to wash their hands only when it's indicated. So if their hands are visibly soiled or they've had contact with soiled material, those times, and we'll get to that in a second, when it's specifically indicated to wash your hands. If irritation occurs, occupational health should keep some cotton glove liners in stock. And if someone needs to use cotton glove liners, then they should be educated about when those should be changed. So a cotton glove liner should be changed whenever hands need to be cleaned. Some are launderable, some are disposable, but that is something to check in with your occupational health department to see if they have for those healthcare workers who have irritated skin. Also, for fingernails, they should be short and natural, and by that we mean not artificial. So previously, artificial nails, it was said that you should not wear them if you work in a high-risk area, and really artificial nails, acrylic nails, really should not be worn in healthcare, among healthcare workers, because of their propensity to harbor fungi. Fingernails should not be longer than the fingertip. So this image where you're looking at the palm of the hand and you cannot see the fingernails is an indication that the fingernails are the correct length. That is a much easier way to look at the length of the fingernails than to try to measure a 1/4 of an inch or 2 millimeters. Really just simply have them hold their hands in front of themselves. If they can see their fingernails above their fingertips, their hands are too long. And scrubbed surgical personnel should not wear nail polish. We get lots and lots of questions about that. There will be a letter to the editor coming in the next issue of Itchy. But the reason we made that recommendation is because the longer that individuals wear nail polish, the more likely it is to have bacteria that's difficult to remove. For that reason, if they wear nail polish, it should not be chipped and it should be fresh. It's really impossible to evaluate if nail polish is fresh. So you can easily see if it's chipped. But WHO, AORN, and other international guidelines recommend removing fingernail polish immediately prior to performing surgical hand scrub. And it is not feasible to ethically study an association between nail polish on the hands of scrubbed personnel and surgical site infections. Just the risk to the patient outweighs any benefit of that type of study. So that is based on on consensus and international guidelines, but we do say that surgical scrubs personnel should not wear nail polish.
Janet, this is
Yes.
Julia. I think people are having a hard time hearing. I don't know if everyone is having that challenge, but we're seeing that in the chat a little bit. I don't know if you can speak up or move closer to the microphone if you don't mind, please.
Is that better? I'm using my headphone. Is that better?
Yeah, I think so. I mean, I can hear you. So
okay, I turned my volume up. I don't know if that would have. I think of my volume as what I hear, but we'll see.
yes, thank you very much.
Thank you. Thanks for the comments. Thanks for making me aware. Keeping your hands clean. So now we'll talk about when should healthcare workers clean their hands. I think most of you are very familiar with this. I do want to point out that the CDC core practices, which is located in the CDC guideline library, if you Google CDC guideline library, you will find it. The core practices has aligned the CDC indications for hand hygiene with the WHO opportunities. So you'll see the 5 moments for hand hygiene here, immediately before touching a patient or resident of long-term care, before an aseptic task like handling an invasive device, an intravenous line or a urinary catheter, after contact with blood or body fluids, after touching a patient or resident, after touching the patient environment, and before moving from work on a soiled body site to a clean body site is a specific indication in the CDC core practices. And we really also want to emphasize immediately after glove removal. So helping healthcare workers get that muscle memory that as soon as they take their gloves off, they clean their hands, whether they wash them or use alcohol-based hand sanitizer, but making sure that that's done as soon as they take their gloves off. We know that their hands are going to be contaminated when they remove their gloves. And we really, want to make sure that they've got that muscle memory. And in addition, as I said earlier, they should wash their hands when they're visibly soiled before eating and after using the restroom. And then I usually like to add before feeding a resident if they're in long-term care. And after assisting a resident or a patient with toileting. So those are the indications for hand washing. They should wash their hands about 15% of the time and use alcohol-based hand sanitizer about 85% of the time. So again, in the core practices, that is where you will find the CDC guidance that says that alcohol-based hand sanitizer is the preferred way to clean hands when they aren't visibly dirty, and that is because of the effect of hand washing on skin, and also because it takes less time and is easier to do. Alcohol-based hand sanitizer is also more effective at killing germs on the hands than soap. Soap is intended to remove germs, not kill them, and it's less irritating, as we've already covered. Alcohol-based hand sanitizer is easy to use. The product goes on the hands, and I know you'll do this in your simulation. I loved doing it last year, making sure that all surfaces of the hands are covered. CDC does not prescribe a way that you need to apply. So other entities like WHO will have you apply to your palms and then the back of each hand, your thumbs, and then your fingertips. CDC simply says, use enough hand sanitizer to cover all surfaces of your hands. It should take at least 15 seconds, and you should use an alcohol-based hand sanitizer with at least 60% alcohol in liquid gel or foam. So many times alcohol-based hand sanitizer wipes are available for patients to use or residents of long-term care, sometimes on their nutrition trays. That is great. There's not a lot of data about alcohol-based hand sanitizer wipes and their efficacy against gram-negative bacteria. or fungi. And so we really recommend using liquid gel or foam for healthcare workers. Again, these are the indications that we've already covered, so I'm just going to click through these. And you can, that's a slide that's available for you to use with healthcare workers, but you don't need me to repeat that. And then soap and water, there are lots of graphics about how to wash your hands. It's really important to remind healthcare workers that soap and water is only effective when you're using thorough technique. WHO says that it should take about 60 seconds to thoroughly wash your hands, and we want to focus on cleaning hands at the right time. We do want to point out on some of the non-healthcare CDC websites, they will point out that alcohol-based hand sanitizer doesn't kill all germs, which is a true statement. But we also want to point out that hand washing may not remove all bacteria, especially when you're dealing with C. difficile. So C. difficile is a very sticky spore. It will stick to hands. I think of it the way I think of burrs when I walk through like a field of grass and you come in and those burrs are stuck to your socks. Then you can, take the sock off, run it through the washing machine, and it comes through the washing machine and the dryer, and the burr is still stuck to your sock. That's how C. difficile acts on hands. So it may not remove all bacteria. The best way to protect your hands from exposure to C. difficile is to wear gloves. And of course, CDC recommends contact precautions, but we really want to reduce hand contamination when dealing with patients or residents that might have C. difficile. Again, we get a lot of questions about how long you should wash your hands. 20 seconds has really been taken up by the general public. It is fine, absolutely fine to wash your hands for 20 seconds. I will say there's not a lot of evidence about 15 seconds versus 20 seconds. And when hand washing products are tested at the FDA, they are tested for a 60-second hand wash. And so one of the things that is in our hand hygiene guidelines are some older studies that show how long healthcare workers spend when they are scrubbing their hands. And 15 seconds was kind of the median. There were many, many studies that showed less time than 15 seconds. So scrubbing your hands for 15 seconds is actually quite a long time. And again, one of the reasons that we prefer alcohol-based hand sanitizer, because you can continue your tasks while you are scrubbing your hands. And again, this is just a slide that you can use with your personnel to to talk about the indications for when they should wash their hands. And again, that should be about 15% of the time. And about 85% of the time, they should be using alcohol-based hand sanitizer. We do say the actual recommendation is that you wash your hands after caring for a person who has C. difficile or norovirus during outbreaks. But if they feel that someone has infectious diarrhea and they may have had exposure to feces, then hand washing is always appropriate. Gloves. Gloves are a double-edged sword. They can be the best defense against hand contamination. They can really prevent hands from, especially with C. difficile, encountering those spores. But we know that when they are removed, healthcare workers are going to contaminate their hands. Some of the studies that we looked at in the compendium looked at people who were donning and doffing PPE for Ebola and were using 2 pairs of gloves for high-level PPE and still had contamination of the hands after double gloving. So hands must be cleaned immediately after taking gloves off. And if I were going to get into a battle with someone about when they should clean their hands related to gloves, I would focus my efforts on cleaning your hands immediately after removing gloves. and then using gloves whenever blood or body fluids might be encountered. Additionally, when there's anticipated contact with mucous membranes, non-intact skin, a patient or resident on contact precautions or enhanced barrier precautions, we need to include that now, and handling soiled items and surfaces or equipment that has been used in invasive procedures. But here's the other side of the picture. Many times individuals will don gloves and then go on to complete multiple tasks while they're wearing the same pairs of gloves. So Deb Birdsall is the author of this study, looking at all of the things that certified nursing assistants touched while they were wearing contaminated gloves. And it's interesting to me that wipes or packaging, so disinfectant wipes, patient skincare wipes were touched with contaminated gloves. And some of those, if they don't have disinfectants in them, may harbor that contamination. Skin, clothing, wheelchairs or walkers, not changing gloves after assisting with toileting before helping someone put on clean clothes, not changing gloves after removing bed linens and then putting clean ones on. All of those things can cause gloves to contaminate the healthcare environment. So when wearing gloves, we want healthcare workers to clean their hands before they put them on, and as soon as they remove them. We want them to change them whenever they're damaged, if they're moving from a contaminated site to a clean site, whenever the gloves look dirty or visibly soiled after completing a task. And it's really hard, I think, for healthcare workers to really notice that they've completed one task and they're moving on to another. So it's really good to teach them to remind one another to point that out. And then moving from one patient to the care of another, gloves should never be used for the care of more than one patient. And then we do want them to carefully remove their gloves when they take them off. That is to prevent hand contamination, but we can anticipate that hand contamination is going to happen. And 2 pairs of gloves does not prevent hand contamination when gloves are removed. We do not recommend double gloving unless it is specifically indicated for a certain disease like Ebola or a certain task like a pharmacist who is compounding TPN or chemotherapeutic agents. Sometimes double gloving is recommended in operating rooms. It is sometimes recommended to reduce needle sticks. We do not want people to clean disposable gloves. Gloves to be used in the care of one patient and one patient only, and disposed of as soon as a task that has soiled them has been completed. Again, never wear the same pair of gloves in the care of more than one patient. That's really hard to do, especially in long-term care, semi-private rooms, when you're moving from one area to the next and you have 2 patients on contact precautions. Sometimes it just, doesn't make sense to stop and change your gloves, but you absolutely must. And then again, not wearing 2 pairs of gloves unless specifically indicated. So we really want to encourage clean hands. It is a team effort. There are so many opportunities to clean one's hands that we want everyone to feel like they can speak up and help one another. And that is really how it should be presented. We need to help one another. There are hundreds and hundreds of indications to clean one's hands during the course of a work shift. And it's impossible for anyone to remember all of those. So we need to help them have access to supplies. Healthcare workers should not need to look around for the alcohol-based hand sanitizer. If it's not in their workflow, they will not use it. If they have to look for it, they will not use it. So if you notice that you can't find the alcohol-based hand sanitizer, that would be something to report to a supervisor. And it would be really great to work with your environmental services or your facility operations to make sure that the hand sanitizer dispensers are located in the workflow of the healthcare worker. If they're empty or non-functioning. And so one of the things that's been really helpful in acute care facilities, those that are really aiming to get high ratings from Leapfrog is now requiring that they assess their dispensers to make sure that they're functioning and to make sure that they are dispensing an adequate amount of hand sanitizer so that healthcare workers have access to the supplies that they need in order to do hand hygiene. Again, gloves are not a substitute for clean hands. And as much as possible, if we can slow down and focus and be aware of what we're touching and take a pause before we enter a room, that can help us stop and clean our hands. I will not share this video right now, but it is about team accountability in this scenario. This is available on our Hand Hygiene in Healthcare website. There are two colleagues who are having a discussion about how one of them just used alcohol-based hand sanitizer on the palms of her hands, and the other is encouraging her coworker to slow down and use alcohol-based hand sanitizer to cover all surfaces of the hands and to really take the time to use good technique. And really just a reminder that keeping hands clean is a team effort. We need everyone to work together to make it happen. No one can remember to clean their hands all the times that they need to. So being able to speak up and keep hands clean is very important. So with that, I'm going to pause and take questions. I see lots of comments in the chat. I hope they weren't just about my volume, but I'm happy to stop and take questions. Thank you so much.
Thank you very much, Dr. Glowicz. That was fantastic. We did have one question. So one of the questions was, so is the rule of using hand sanitizer 3 times and then you have to wash your hands still a rule that has to be followed?
That is an old rule and really based in myth. There is some of the older hand sanitizers had very heavy emollients in them, and so sometimes healthcare workers would report that their hands felt sticky, particularly if they had aloe in them. Aloe really feels sticky, so sometimes after they used hand sanitizer 3 times, they might feel like their hands just had gunk on them. That should not be the case. That is not a rule that anyone should be taught or follow. If your hands feel like they need to be washed, then you should wash them. But otherwise, you can use hand sanitizer as frequently as possible because, like I said, it is more effective at killing germs than hand washing is at removing them.
Great, thank you very much. One comment was we have a lot of issues with the contact dermatitis with the glove use.
Yeah. So one of the things I didn't talk about, but that was a concept I learned. It has to do with wet work, and wet work is done by people who put their hands in water for more than 2 hours a day, wash their hands more than 20 times a day, or wear gloves for more than 2 hours a day. And so nurses fall into that category, a lot of food workers fall into that category, and a lot of hairstylists fall into that category. So they're called wet workers, and these are the occupations that tend to have the most contact dermatitis. So when it comes to glove use, again, removing gloves appropriately cotton glove liners can help with dermatitis if someone has to wear gloves for prolonged periods. And also giving their hands a break when they're off of work. So when they are not working, they can continue to use alcohol-based hand sanitizer at home. They should make sure that at home they're not using hand soaps or hand sanitizers that have fragrances in them, because that can cause additional injury. So when they're off from work, that is a great opportunity for them to give their hands a break. And then also applying lotion at regular intervals. So just making it a habit to apply lotion at the beginning of your shift. You know, when you put your stuff in your locker and close your locker, put some facility approved lotion on. When you go to the nurse's station to chart, put some lotion on. So just building that application of lotion regularly throughout the day and making sure that it's facility approved lotion that has appropriate preservatives and that is compatible with gloves. Those are some actions that might help. And then consulting with occupational health.
Great, thank you very much. Do you encourage use of Glowgerm? Any issues with allergies with Glowgerm?
Haven't seen any issues with allergies with Glowgerm. I like Glowgerm. There are some other things that you can use, and I think you're going to use some of them in your simulation tomorrow. So you know, whatever with hands, I think I would be one of the things that's fun, an activity that is done uses ketchup, and so they take ketchup and put that on gloved hands and then have people remove their gloves and try to not get the ketchup on their hands. I've also seen that done with chocolate sauce. Both of those can be fun. I like Glowgerm to ensure full coverage of the hands, and I have not seen problems with allergies to Glowgerm. And that's the Glow Gel, right? Yeah.
One question was around, or one comment was around Glowgerm for training purposes or simulated scenarios for Kentucky Infection Prevention Training Center. So just one clarification, the simulation trainings are actually next week and the week after, but we use it for simulated scenarios for training. And so Dr. Glowicz, I don't know if you have another way that you've heard of it being Glowgerm being used. But
yeah, so they may talk about this later. There are other products that you can use on surfaces, but when it comes to something that you're putting on your skin, I would stick with Glowgerm. Yeah.
One comment is that we use the rule of alcohol-based hand sanitizer 3 times and then washing only during the passing of food trays.
So passing of food trays, that, you know, is an action that's done really quickly. There's 2 indications for hand cleaning there, right? So entering the patient or resident's room and touching the patient or resident's environment. So you would want to clean your hands before you enter that room. That's going to cover you for both of those indications, right? That's very minimal contact, really. And so I would definitely I would not encourage hand washing after passing 3 trays. I would encourage food and nutrition workers just to use hand sanitizer unless they, you know, come in contact with, you know, something that makes their hands visibly soiled. But alcohol-based hand sanitizer should be absolutely fine. And I would want to see them. There is a concept called double dipping that you just need to be aware of when you're instructing them. So if they come out, clean their hands, immediately grab a tray and go into the next room, they have hit those indications for after they've touched the patient's environment and before they touch the next patient environment. They don't need to do it at each threshold to the patient room. They can come out, clean their hands, grab a tray, go into the next room, especially if they're moving quickly.
Great, thank you. We had a question on where are the germ lights available for purchase? So I can answer that. I know that we have ordered them from many vendors. They're black lights, so they are we've seen them on Amazon and a lot of, you can go to the internet and really get them. They will be one of the things that will be available at our SIM trainings next week and the week after. And the comment was, I'm very interested in putting them to use with random testing and monthly hand hygiene training. And I think Dr. Glowicz, you've mentioned that multiple times as a very nice way to ensure that people are doing what they think that they are doing in the best capacity that they can.
Mm-hmm.
One question is around the best placement of hand sanitizer dispensers, at the door, in the room, or both. We have a sink in the room, but concerned that might not be utilized like they should.
So we recommend, especially in long-term care, one outside the room and one inside the room, so that you can use hand sanitizer while you're in the room providing care. Sinks inside the room, depending on where they're located, can cause a lot of environmental contamination. So we really don't want, for example, certified nursing assistants in long-term care going to the resident's restroom to wash their hands. Using an alcohol-based hand sanitizer in the room is going to be much more effective for cleaning their hands than that type of situation. In acute care facilities, it really depends on how the sink is built. We don't want to cause splashing or aerosolization of bacteria from a hand washing sink. And so I didn't really talk about sinks in this presentation, but we need to make sure that hand washing sinks are used for hand washing, and that we take steps to prevent splashing from them. But when it comes to the best placement for alcohol-based hand sanitizer, there was one study that looked at all the different places within a room where alcohol-based hand sanitizer could be placed, and they found that when they had one in the hallway and one inside the room in the workflow of personnel, that was all that they needed. So we do recommend one outside the room and one inside the room.
Great, thank you. We had a question around, what are some common misconceptions about hand hygiene that you've heard?
One of them that doesn't come out, well, one of them is the three uses of alcohol-based hand sanitizer. So we've talked about that one. Another one is fire safety. And so it's important to recognize that you can have 10 gallons of alcohol-based hand sanitizer in a smoke compartment. And a smoke compartment is, where you have automatic doors that close. That defines a smoke compartment. And the 10 gallons refers to the amount in the hallway. Each patient or resident room is its own smoke compartment. So you can always check in with your fire marshal about that, but generally it's pretty hard to have 10 gallons of alcohol-based hand sanitizer in a smoke compartment. Generally, you can have as much as you need to get the job done. And that, just keeping in mind that each patient or resident room is its own smoke compartment. And then there are sections of the hallway where you have doors that automatically close. Those are the smoke compartments in acute care and probably in most long-term care facilities as well.
Great, thank you. Are the manual or automatic dispensers more recommended?
That's a really good question. All of these have been great questions, but thank you for bringing that one up. They both have pros and cons. The manual ones, sometimes folks are like, well, everybody's pushing that with their dirty hands. They do need to be disinfected. All of them need to be disinfected on a regular basis by, your environmental services personnel. With either type, the most important thing is making sure that you're getting an adequate amount. So there are some hand sanitizers that are popular because they don't dispense very much hand sanitizer. So you might, there are automatic ones that just dispense a tiny amount, which just give you enough to rub your palms. Sometimes healthcare workers prefer those because the hand sanitizer dries so quickly, but generally they haven't gotten enough to really do effective hand sanitizing. So the most important thing is making sure that whatever you use, manual or automatic, the healthcare workers are getting enough. I think one of the most disheartening things I've seen on an outbreak investigation for a multi-drug resistant organism involved an alcohol-based hand sanitizer that the healthcare workers were using and really trying to do good hand hygiene, but it gave them such a tiny amount that they could not kill the germs on their hands. So just make sure that whatever type of dispenser you use, the healthcare workers get enough to cover all surfaces of their hands. Thanks.
So that segues beautifully into the next question. How much sanitizer is needed? 2 pumps, soaking the hand?
So what I like to do I think that Leapfrog recommends that you dispense into like a medication cup and you look to have 1 milliliter. And I don't remember exactly their protocol. What I like to do is just dispense it into my hands and have someone see how many seconds it takes me to cover all areas and how long my hands stay wet. And that needs to be at least 15 seconds. So if someone has large hands, they may need to activate the dispenser more than once.
Okay. So as it relates to monitoring or observing for compliance with hand hygiene, it sounds like there's potentially 2 things to monitor for. One is performing hand hygiene at the correct opportunity, and one is performing hand hygiene correctly.
Yes.
So do you have suggestions on how those should be done? So I know people do covert, they do overt observations. Are there recommendations or suggestions around best practice for observing both compliance with and understanding of how to perform hand hygiene correctly?
So I love what I heard in one of the questions earlier about Glowgerm. They were wanting to put the lights to use on a regular basis. That is a great way to do overt checks of technique. And that is one way to do observations. When you're doing overt observations, that means that the person you're watching knows that they're being watched. We want to see them adhering to hand hygiene, and we want you to have a hand hygiene rate of 100% if they know that they're being watched, because if you see a lapse, you should be stopping them. So good times to use overt observation are times like during central line insertion or during urinary catheter insertion, where if someone sees a lapse, they can stop and say, oh, we need to clean your hands before after you take that central line dressing off, clean your hands before you put the new one on. That is a good time to do. High risk activities are a good time to do overt observations. For covert observations, we want to take some steps to avoid bias. So we want to make sure that we're seeing lots of different types of healthcare workers, that you're probably going to see more nurses because there just are more nurses on patient units. We want to make sure that we don't do them for very long. So if you stay longer than 15 minutes on a unit doing hand hygiene observations, you're no longer covert. Everyone will know that they're being observed, and your hand hygiene adherence will go way up because they know that they're being watched. And we want to make sure that we kind of randomize the units that we go to and make sure that all units are assessed on all days of the week and on all shifts. So that's hard to do and really labor intensive. For that reason, many facilities are going to automated monitoring. That is a topic all to itself, but it does give you data every day on all shifts. But again, that's its own topic. So thanks.
Yes. So recommendation for environmental services for sanitizing dispensers, daily, weekly, monthly, quarterly, and should it be documented?
So the National Fire Protection Agency and Leapfrog both state that when the alcohol-based hand sanitizer is changed, so when they're refilled, they should be tested. So do make sure that you build that into your process so that whoever changes the dispenser is checking it out, making sure that it's functioning appropriately. And then I would recommend that they be disinfected daily at a minimum. Whenever, if EVS is cleaning the handrails on an inpatient unit, they can hit the handrails and all of the alcohol-based hand sanitizer dispensers. And then when they're doing a daily clean inside a room, just the same way that they do the faucet handles. So at a minimum daily, in an outbreak situation, more frequently, perhaps.
Okay. Are pocket hand sanitizers recommended?
So some facilities choose to use them. It really depends on the risk to patients, and there's two ways to think about that risk. If you're in a long-term care facility, so first of all, you should not have pocket hand sanitizers in place of wall-mounted dispensers. You should have access to wall-mounted dispensers in the workflow. But pocket hand sanitizers may be useful in some areas like behavioral health. In behavioral health, you have to be very careful that they remain in the control of the healthcare worker. So in behavioral health, it can be problematic to mount alcohol-based hand sanitizers because of the different threats to patients. They do manufacture alcohol-based hand sanitizer dispensers that are anti-ligature and that have lockouts after a certain number of dispensing, like you can dispense once or twice and then it locks out for a certain amount of time. If you choose to use individual pocket-sized containers in a behavioral health setting or in a long-term care setting, say a memory care setting, you need to be aware that they are more drinkable than those that are in dispensers. So, making sure that they stay in the control of the healthcare worker and that they're used. There are studies of the use of pocket-sized dispensers have not shown improved hand hygiene when healthcare workers carry them with them. It's much easier when it's on a wall and it's in your workflow. And the other point that I would like to make, Julia, is that non-alcohol-based hand sanitizer is sometimes used in behavioral health. CDC makes no recommendation about non-alcohol-based hand sanitizer. In the most recent SAY compendium, we recommended not using non-alcohol-based hand sanitizer. Those are usually made with quaternary ammoniums. And there is a growing body of evidence showing that the quaternary ammonium compounds, can be absorbed and potentially harmful. So FDA is actually collecting data about the safety of alcohol and quaternary ammonium as hand hygiene agents. But given some of the literature that I've seen regarding the safety of quaternary ammonium on the skin, I would not put non-alcohol-based hand sanitizer. And I will claim that as my personal opinion.
All right. Thank you. Should you remove jewelry when performing hand hygiene?
We did not make any recommendations about that. I know that others do. In NICUs, there are efforts to do bare below the elbow, so no jewelry in a NICU. There's often no jewelry in surgical suites. Canada says one small ring. CDC doesn't make any recommendations about that. Although, if you see jewelry that's getting in the way of someone doing thorough hand hygiene, I think that's a good opportunity to speak up. And that is also something that should be written into your dress code policy, not necessarily your hand hygiene policy.
All right. When it comes to monitoring and providing feedback to someone who missed an opportunity for hand hygiene, do you have any scripting to help provide that feedback?
I would work with your personnel on what they like to hear. One of the automated hand hygiene systems offers immediate feedback as people walk through, if they walk past the alcohol-based hand sanitizer, and initially it would say, remember to wash your hands, and that was very irritating to the healthcare workers. So they changed the message to simply say, thank you for washing your hands or cleaning your hands. And that was much less threatening to the healthcare workers, and they ended up going with that as the immediate feedback. So I would say make it positive and script the response as well. So if you tell, just as an example of someone who, we're all a little intimidated by, that cardiac surgeon who walks on the unit, but doesn't clean their hands before walking into a room. If you can say, thank you for cleaning your hands, and then they are also scripted to say, thank you for the reminder, or some other positive message. I really like the way one of our folks at CDC has phrased it, and it has just been kind feedback. Just be kind, and be help people out, and just recognize that we can't all remember all the time. No one performs at 100% all the time. So we need those reminders, and we need each other to be a team.
Some of the strategies that we have used, or that I've used in the past, is if you perform hand hygiene, others around you will do it as well. So
absolutely,
if you put an alcohol gel bottle on a table and clean your hands, the whole table ends up cleaning them. So one of the strategies that we have done is if somebody needs to clean their hands, is you just clean your hands and they will clean theirs as well. Just out of kind of a human behavior kind of thing. So
yeah.
Another strategy, if it's in a situation where having that conversation may not be appropriate at the time, but would still get that outcome that you desire. One other question we have is, how can we encourage better hand hygiene practices in our daily lives, both at home and in public spaces? Any tips?
The number one tip is to make sure that people have what they need to do hand hygiene. If they don't have what they need, they can't do it, and they will forget by the time they get there. So making sure that the supplies are there, that they work, and that they're in the workflow personnel. And that's true at home or at work.
All right. Anybody have any other questions or anything that I missed? I'm looking back through to see if I missed any questions from anyone in the chat here. If we did not answer your question, if you'll just repost it in the chat so that it goes back to the bottom, that would be great, or put it in the Q&A.
Thank you so much for a great discussion. I loved the questions.
Yeah, these have been some fantastic questions from the group, and I think it's always good to have these conversations with our colleagues. I got a comment. I went to a large sporting event and they had hand signs on mirrors and doors in public restrooms stating, "Thank you for washing your hands." So nice. Positive reinforcement. That's great. Yeah. All right. Well, thank you.
Yeah. One last tip. In a
Sure.
public restroom at a sporting event, there's a nice study that showed that if the paper towel was visible, people were more likely to wash their hands. So after you wash your hands in a public restroom, just let another piece of paper towel come down, and you'll be encouraging that next person to wash theirs. So
how interesting. And human behavior is always very fascinating to me. So,
Great.
well, thank you very much, Dr. Glowicz, for your wonderful presentation.